Hi, everyone. It's Dr. Azi here. Welcome to the More Than a Pretty Face podcast. Hey, guys. Welcome back. Another podcast with Lacie, and we are still twinning it. How are you?
I am good.
I'm so excited I get to spend so much time talking to you on this podcast.
I know. Now that we're back in our routine, we're like catching up more.
I know. And the office has been so busy. I feel like I don't ever get to see you, and you're either in the front or in the back
or everywhere. You know, I just have my fire extinguisher and I just run around the office like a crazy woman.
You need to schedule yourself with me. I feel like, although I love everyone else in the office, but there's something about working together. I like working with you.
Yeah, it's just our connection, our bond.
But I feel like when you're not, I feel like we get out of sync when you're.
Yeah, I feel it.
When too much time goes by.
Yeah. Well,
so, what's new?
I was like so excited's the wrong word for my beauty and blemish today.
Oh, well, it's always interesting when blemishes are exciting.
Mm-hmm. Yeah. Well, I was super excited. My husband and I had planned a day where we both took off of work and we were just going to have a self-care day.
Oh.
You know, Remy's in school, so we have a babysitter already lined up. School.
That is a great idea.
Yeah. So
a mental health day, they call it now.
Exactly. Yeah, that's exactly what it was. The plan was to wake up early. We went to a spa and like it was a great time. It was very much needed. However, my blemish is that about 3-4 days prior, actually leading up to that, a week prior, my eyes were really bothering me. Like just felt really dry. They felt really like burning and just wanted to shut. And then I felt like that Friday prior to, I had something poking me in the eye and I like just wiped. And of course I just put my glow serum on, so I didn't want to use like my fingers. So I used like the back of my thumb. And let me tell you, the amount of burning that I had in the corner of my eye after I did that, I knew I had to have gotten my serum in my eye. I had to have done something for my eye.
Of course, you and your eye.
So. And everyone that knows me, like I have such an eye phobia. It's not okay.
Yeah.
And so, of course, I wake up the next day and my eyes are huge, swollen. Like I look like I'm having like that movie with Will Smith when he eats something he's allergic to and his whole face swells up. My eyes felt like that.
Oh no.
My eyes were so big and I'm freaking out. I'm texting you. I'm like, I don't know what to do. And the next day after, my eyes are still swollen. The swelling is now like under my eyes. I'm freaking out. I go down this whole rabbit hole of like Googling because, you know, I tell patients not to Google, but I'm like, well, let's just see.
We all do that.
I came down this thing where it was like retinol causing your like glands in your eyes to open up or
your meibomian glands. Meibomian gland dysfunction? Is that what you're talking about?
Yes. So I had to ask you about it. It's like I'm saving this for the podcast.
Well, you know, the eyelids, when they swell, sky's the limit. They can really, you can end up looking like a frog because it just stretches and swells and it can be really scary. And it's normal to sort of freak out and go through what could this possibly be, because sometimes it comes up first thing you do when you wake up in the morning. But the eyelids are very sensitive. You know, the eyelid skin is very thin. And you hear people say, it's a scam, you know, don't buy eye creams. Eye creams are the scam. Well, you can use the same cream you use on your face, on your eyes. Wrong. I still believe in eye creams because I do think that it is different skin, it's different tissue, and it's a lot more delicate. So you could have certainly had an irritation. People don't realize that things in the air can get in the eyes and cause irritation, like perfume, scented candles, Gel acrylic nails, that's a big one. People don't realize that if you have acrylics or freshly done gels or gels that you may be doing at home and you rub your eye, one exposure, it's like poison ivy for you. And so there's lots and lots of things that could have caused that reaction. I think at the end, I know you texted me and you were freaking out, but a lot of times it's not an infection, but more so an irritation.
Yeah.
But you bring up a good question because I get this a lot from patients. Does tretinoin or Retin-A, in fact, the other day we had a lady come in and she was using prescription Retin-A, like 0.1%.
yes.
Remember her?
Yes.
She was like, could barely see. She was trying to sign in on the iPad and she couldn't see the iPad. And we talked to her and she has been using Retin-A 0.1% around her eyes. And she said that she ended up getting this because she wanted to get her crow's feet to go away, all the wrinkles and lines to go away because she heard Retin-A does that, and it does. But I think overdoing it could certainly cause dryness and irritation to the eyes. But this whole thing of meibomian gland dysfunction and dry eyes being caused by Retin-A, that's a hot topic, somewhat controversial, but here's my take on it. We really simply don't have enough science and data to say that yes, topical retinols and tretinoin cause dry eye syndrome and meibomian gland dysfunction. I mean, that is just straight facts, right? Now, Accutane, which is the oral form of Retin-A, does. It can certainly shut down or reduce your meibomian gland secretions and therefore cause dry eyes. But that is an oral medication. You're taking it internally, so it's going to have a much greater effect than a retinol you're applying topically. Now, the number one cause of dry eyes is what? Do you know?
I would assume allergies.
Aging.
Well,
Aging.
ding, ding, ding.
Particularly in women, because for those of you who may not know, meibomian glands, they secrete this coating, this oil aqueous solution that coats the eyes and protects the cornea, right? So if you don't have it and you get dry eyes, it could affect your vision. You could potentially go blind. It could be very uncomfortable. And so when those meibomian glands, which sit right at the base of your eyelashes, they're not functioning or they're not producing enough of the oil, that protectant that mixes with the tears from your lacrimal glands, then that coating is diminished, and that is what dry eye syndrome is. Now, the other thing is women are more at risk because as we age, our androgens, the male hormones that are the ones that stimulate oil secretion and stimulate the meibomian glands, diminishes, as does estrogen. So that could certainly affect the hormonal climate, could affect dry eyes.
Lucky us.
Not to say that men don't get it as well, but one of them, it could be under hormonal influence and other things that happen with the aging of the eyes. But the number one reason actually for dry eyes is not Retin-A or tretinoin use. It's actually eye drops. With topical eye drops, particularly ones with benzalkonium in it, which is a preservative. And I don't know if you saw my video on the Lumify drops.
Yes.
So the Lumify drops that are designed to make the whites of your eyes even whiter because they take the red out, they close down your arterioles. It says on the bottle, use it 4 times a day. And some people use it daily, which is I do not recommend that, because over time you can get sensitized to benzalkonium preservative that could cause irritation, which can then further, cause the dry eye syndrome.
Well, I still don't know what caused my flare up, but my eyes I took a break. I told my husband to no cologne, no sprays. We haven't had any candles, and I hadn't even wore any of my daily skincare because I was just like, what could it be? I don't know.
You just have to take a break. Those are the big triggers. And some people say, well, I don't really spray the perfume on myself.
My husband.
Your husband, if he wears cologne or your boyfriend, that's fragrance that could potentially get around your eyes.
Yes.
You walk into a spa and they have aromatherapy.
So yes, so then this happened right before our spa day, right? And my eyes got a little bit better, but I still looked so horrible. And like my husband and I don't have dates very often. I wanted to be like sexy and like not sexy for the spa, but like, you just wanted to feel good, look good.
Look good, yeah.
And I just felt like, I have like puffy eyes, and like my biggest thing, if you guys don't know, is like my little eye. I feel like this is my little eye. It was the worst one that was affected. And so like my eye wasn't even open because it was so swollen. And here we are like on our self-care day. And I'm like,
that is
hideous.
Such a bummer. I'm so sorry.
And we walk into the spa and, aromatherapy. And then, it was a great experience, but my eyes were not having it. And even like today, they're like really bothered, just dry.
Well, yeah, that's the thing. One contact with an irritating substance can last for several weeks, actually up to 6 weeks if you don't get it treated. If you do get an allergic reaction around your eyes, you can use a product like Soothe HC, which has a cortisone in it. It's a very mild over-the-counter cortisone, but you can use that a few times a day for short period of time, like 3 days, and it knocks it out really quickly.
Yeah.
So that's a good option. You can also apply a coating of ointment like Vaseline, which protects the eyes, it hydrates the eyes, and it can help self-repair the eyes. But if you truly have a rash that doesn't go away, see your doctor, because it's really important to take care of some of these symptoms if they go on and on and on. A lot of times they may resolve on their own, but if it's an ongoing thing, it's really important to see your doctor. But in terms of retinols, because they do work amazingly well for the fine lines around your eyes. Now, the crow's feet, the ones that when you smile come up around the sides of your eyes, those you really need Botox, because honestly, they're caused by the orbicularis oculi muscle that contracts and it crinkles up the skin, causing those lines. We just need to prevent you from being able to contract that muscle and crinkling up the skin. I mean, it's just very simple. Botox for the lines, for the upper third of the face. Now, some people think Botox for the under eye area, like those little fine lines under the lash line, helps.
Yeah.
And this is a yes and no question, because it works in people who have something called muscle recruitment. Do you know what that is?
Yes.
Okay. So,
explain it to our listeners.
So muscle recruitment, let's say you've been getting Botox for, like me, since I was like decades, right? And what happens with time, your muscles can become atrophied and they can become thinner. And so other muscles in the area can start to get stronger and become thicker and more powerful, because it's going to overcompensate for the muscles that are not working.
Yes.
And the bunny lines are a classic example.
Classic.
Nicole Kidman, if you guys know who she is, she's a classic example of doing Botox for long periods of time, but not getting the bunny lines, so they get stronger. And then the muscle, this medial aspect of the orbicularis muscle, can also get stronger. So even though part of the muscle is not working, other parts of it can start to work. And some people say, I get Botox around my eyes, but then I start getting these lines, like these other lines under there. Well, Botox can help with that. What I like to do is just do hyperdilute micro droplets just all along the medial aspect of the orbicularis muscle. And that can soften that recruitment phenomenon and the lines that can occur as a result.
Yes.
Now, you have to be careful, because in some people, it can make their eye bags worse. And I'm talking about if you're injecting right under the lash line, on the lower eyelid area, sometimes you make that a little too relaxed. And what happens is the eye bags can become more prominent.
Yes.
And you can actually get some other changes that are not welcomed. You also have to be careful with dry eyes, because Botox can also affect your lacrimal gland secretions and your glands in that area that lubricate the eyes.
Yeah.
So there's a lot that goes into it, and it should be customized per patient. So talk to your injector if that's something you're experiencing, because it could definitely be improved. Oh man, you've got a lot of stuff going on that weekend.
I know. Well, before we get into your blemish, you guys don't forget to rate, review, and subscribe to our podcast and follow us on Instagram at More Than a Pretty Face Podcast. We love seeing you guys screenshot your episode and tag us in your stories.
Yes, don't forget to tag us at More Than a Pretty Face Podcast and at Skin by Dr. Azi. And we do a lot of skincare giveaways.
Yes.
So make sure you tune in.
So how about you? How about your beauty and blemish? I am so sorry that mine just seemed to be like so amazing that we just like keep talking all about it.
Well, I'll start with my beauty because I'm so excited. We're getting the AviClear laser.
Oh, yes. I'm so excited for that.
Guys, this is the first FDA approved, not FDA cleared, FDA approved device for the treatment of cystic acne. And it doesn't involve going on medications like Accutane, which could give you dry eyes. And so it is 3 sessions. And the way the laser works is it really targets your oil glands, similar to how Accutane works. People are claiming that it works just as good as Accutane. So I am so excited because we have so many teenage patients with acne, and not everybody wants to go on Accutane. It's a 6-month commitment. You got to do blood work. Certainly can cause dry eyes, dry lips, dry mouth. It has a lot of potential side effects.
Yes.
It's not like just a medication we can just hand out. But the laser is safe. It's effective. It can be expensive.
Yeah.
You know, it varies in cost between $3,000 to $4,500. But let's say you don't have insurance and you have to pay for Accutane out of pocket. It could be comparable because the medication's expensive. You got to be seen once a month, got to do blood work. So the cost may be very similar.
Yeah, I'm so excited for that.
Yeah, so stay tuned. I'm really excited to see the hype. I know that a lot of us are talking about it and everyone's so excited. So I'm super excited.
Yes. What about a blemish? Do you have a blemish this
So my blemish would be that, well, I guess it's not technically a blemish. I mean, I've been traveling a lot, so it's always hard to come back from traveling because you're always trying to catch up to time.
Yeah.
And I try to work too. I'm always working.
You're always
even on
working.
vacation, she knows. I'm like constantly checking emails and always just working. But my phone died when I was in Aspen for like 12 hours.
That's why I didn't hear from you.
Yeah, for 12 hours. I mean, the phone went dead. Like
I was
went
like, oh, she
black.
finally is enjoying her time off.
Went completely black. And Aspen, I don't know if you guys have ever been there. It's a little town. Like there's no Starbucks. There's no Apple store. So I was like, oh my God, what am I going to do? You feel so disconnected. But, I was skiing and I'm like, what if I get injured? And I don't have my phone. But everyone else around you has a phone, right? But it gives you this, like, I got this anxiety. Oh my God, my phone. I got to find an Apple store. I got to do this. Well, get this, guys. If your phone ever goes completely black and you're like, this is done. RIP iPhone. Call AppleCare because despite me running around trying to figure out what to do, AppleCare was like, oh, okay. Yeah, go ahead and push the volume up button, volume down button, and then hold the power button for 30 seconds. And then it just turned on. I was like, what? I've been stressed for 12 hours thinking that's all I had to do.
Well, what was the reason?
They were like, that's exactly what I said. What was the reason? I mean, it looked like there was no resuscitation possibility in sight of this phone. And I had just gotten it like 2 months ago.
Well, it was overworked.
So they said it was overworked. No, they said that, it could be a million things. It could be a software problem. It could be like, da-da-da. I'm like, really?
Sounds like us with skin reactions.
It could be a million things. But literally, like, there would be nothing. No sign of life.
Oh my gosh.
That's never happened to me before.
Yeah, that's traumatic.
That was my blemish.
I love it.
All right, guys. Thanks for tuning in. Comment below. Let us know what you want to hear on the podcast. And if you find this podcast valuable, don't forget to rate, review, and subscribe and share it with a friend. Thanks for tuning in.
Bye.
Bye, guys.